it was just too old. I mean, you you walk in there and say, well, we can't send people, our young people to, as we have done in the last many years, to put their lives on the line, and many who are come back, that who are need help, and we can't allow that to happen in that kind of facility. The Omaha facility was, um, had been on a list for a number of years, and it just wasn't. I just didn't feel it was going to be built. And so when the Heritage people came, Walter Scott most particularly, came to me and said, I will do this. I will raise the money and leverage the federal money. And so it, yeah, it's a thrill. I know the veterans are going to benefit dramatically, and I hopefully will also the healthcare professionals, and especially during this time of COVID, that the demands are greater now than ever before, I think. And just the spacing. I mean, just going in, just the basics here is, when you walk into the new building, there's so much space, uh, and uh, which is necessary, obviously, when we're conducting, we're trying to deal with this problem. So that alone, I think, will help save lives and keep people healthier.
Yeah. Anything unique about this whole process that you've been through that you want to share or you want people to know?
Well, really, if the politics of it were interesting, and having served in the unicameral for 16 years, I am convinced that what we've lost in American politics is the ability to find solutions across the aisle and to work in a bipartisan fashion. That was certainly more that way when I started. In this case, I had the help of Republicans and Democrats alike from the area, but from across the country, who came together at the very end when we needed a boost to get the bill passed. We were well, nobody thought we could do it to start with, because I was a freshman and member of Congress, from a small state, with mostly Republican state. I was a member of the Democratic caucus. The odds were as I was told many times in the first several months, is that this won't happen, which caused me to think that it's going to happen somehow. Because the other thing is, this started really when I went onto the floor of the House and found the help of a congressman from Florida, Jeff Miller, probably one of the first Trump supporters in the House. And obviously we had differing views on many issues, but Jeff became an advocate. And Governor Walz in Minnesota at the time was there, and he helped. He's a veteran. So I had the coming together of such an incredible assortment of people. And it really wasn't up until about 3 a.m, I guess. I stayed up. The bill then went to the Senate, of course, because it had passed the House, and the 114th Congress was ending the next day. So, I mean, I didn't have a lot of leeway, and the House had recess. So even if the bill were changed in any way and came back, there would be no. The House was gone for the 114th Congress. So, but at 3 a.m, I received notice that the Senate had passed it. So, it was an idea that emanated from our community. There is just no other way to say it. This idea, not only was it was not only an idea, but it was certainly a dream of Walter Scott's. But it was the idea that anything can be done if you bring government and the private sector together in a bipartisan way with a solution-based approach. And uh, that's to me is the lesson of the VA, and of course now all the veterans are going to have a new building.